On issues of health with Dr. Alcena. For this segment of the show, I'm going to continue to talk about sickle cell disease. Sickle cell disease is worldwide. Altogether, there are some 300 million people in the world who suffer from sickle cell trait. In this country, we have 3,600,000 folks with sickle cell trait and about 100,000 folks with sickle cell disease. There are 4 separate types of sickle cell syndrome, as it were. You have sickle cell trait, which is a disease in itself. You have sickle cell SS, which is the homozygous. Then you have SC. Then you have sickle thalassemia. Those are the 4 types of conditions that are associated with the sickle cell disease as we know it. Now, again, when I left off last week, I basically was talked about the heart, talk about the bowel, talk about the gallbladder, the pancreas, and in this segment I'm going to take time and talk about the kidney, because of the organs that get affected the most by sickle cell disease, besides the blood system, of course, is the kidney. And the reason is because the kidney is an extremely vascular organ. All the blood must by necessity pass through it so that it can be cleansed. Can be cleansed to remove all the toxic material that we accumulate in the body as we inhale stuff, as we eat stuff, as we drink stuff, etc. Now, before I proceed, I want to share with you this book that I wrote that came out now a couple of months ago. It's a huge book, The Best of Clinical Medicine for the 21st Century. This book has 110 chapters, 816 pages. I literally wrote it from the top of my head, except for looking up a couple of stats here and there. Take a look at it. Everything has to do with clinical medicine in the 21st century. If it is medicine that you're interested in, it doesn't matter what level you are at. Either you're a practicing physician, you're a medical student, you're a resident, you're a nurse practitioner, whatever, or the general public, you're likely to find the latest information they explain in a way that is completely clear for you to understand. Take a look at it. Your local library should have copies of it. I'm sure there's some place online where you can get your hands on it as well. And there are always a few copies in my office as well. Now, the kidney and sickle cell disease. There are several problems that the sickling phenomena causes to occur in the kidney, resulting ultimately, in many cases, in kidney failure. Firstly, take a look at the shape of these cells. This thing is a little far away from it. You see, this is banana-shaped cells and half moon. They're very sticky. They don't navigate is a better word, freely through the blood vessels, and they get stuck in the blood vessel very easily. And of course, the kidney, which is, I brought a poster of the kidney to show you. This would be the inside of a cut surface of the kidney on the inside. There are multiple structures in there. Among them is a network of material called the glomeruli. The glomeruli is the heart and soul of the kidney, as it were. That's what the kidney function that keeps us healthy, etc. You have to understand, the kidney is not just there to remove waste material. There are several key hormones that are needed, that are in fact produced in the kidney. You ought to know also that 15% of the blood sugar that is metabolized, that we metabolize as human beings, is metabolized in the kidney, 15%. That is why when people have kidney disease, when we're treating them either with insulin, etc., we have to adjust the dose of the medication accordingly, because the kidney is no longer able to produce that 15% that it used to produce heretofore. So it's very, very important to keep that in mind. If you don't keep that in mind, you don't factor that in, then you wind up having a patient whose blood sugar is going to drop, causing recurrent hypoglycemic episode. You don't need that. So, and then what's also fascinating is the fact that the glomeruli, we were born with that definite quantity. You don't produce glomeruli as life goes on. Once you lose it, it doesn't come back. And then the thing is, when you're losing glomeruli, you have no clue, because it doesn't cause any pain. What causes somebody to lose glomeruli? Disease. Diseases that affect the kidney. In particular, occlusive disease. such as atherosclerotic disease of the kidney, the vessel, the tiniest little vessel that goes throughout the kidney, as well as the large vessel. These tiny vessels are necessary to go through the substance of the kidney to perfuse the glomeruli, bring blood and oxygen to perfuse the glomeruli. Now, if that can't happen, then you start losing, we have billions of glomeruli, but you start losing them one after another until you reach to the final point where there's no more, what's left is not sufficient to keep the kidney functioning properly. And then you go into kidney failure. There are, of course, multiple other conditions that can cause one's kidney to fail precipitously. I'm not talking about that. No one knows more about this stuff that can cause that to occur than I do. I'm not talking about that. I'm talking about specifically the blood vessels going through the kidney being occluded by the sickle cells, and they have trouble navigating through, resulting in a local inflammatory process that automatically, by necessity, develops inside that vessel. As soon as the red blood cell gets stuck to the wall of the vessel, the red blood cell gets, that is the sickle cell in particular, gets stuck to the wall of the blood vessel, it can't pass through. That reaction, vessel to cell, result in an inflammation automatically. And once inflammation occurs, the next thing that follows chronically is occlusion of the vessel because of plaque development. Doesn't matter where there's an inflammation in the body. It could be in the mouth, in the toe. Eventually, it gets find its way into the bloodstream, and it's going to wind up in your blood vessel. That is why we do all we can as physicians to treat patients who have chronic infections in their body as vigorously as we can, because we know all the problems that can develop because of it. Now, not only that the cells are causing the clogging, as I just mentioned, but chronically you have the occlusion of the vessel. And then so that's one problem. The next problem that develops frequently in people who have sickle cell disease is bleeding from the kidney, massively, excessively. I'm talking about gross, pure blood, lots of it coming out. Okay, and it's usually coming out of the urinary bladder, and it's a pretty scary sight. Well, what's causing that? Well, let me explain. Again, remember, I know extremely well, thoroughly, all the other things that can cause one to bleed from the kidney, etc. I'm not talking about those things. I'm specifically talking about sickle cell disease. Now, I can't reach there, but this is the kidney, where they're located on the side of the abdomen. It's not easy for you to see, but the left kidney is located higher on the abdomen than the right kidney, because most of the bleeding that occurs usually comes from the left kidney. You say, well, how so? Well, because the substances in the kidney we call papillae. You can't read it, but they're there, the papillae. Because the kidney is higher, it's not getting enough oxygen because of the occlusive process that I just described. It is more prone to bleed because the papillae become ischemic because of lack of blood, or the blood that's they're getting stuck, as I just mentioned. Then they become degenerate. Once they degenerate, then they start bleeding. That's why you got the bleeding from sickle cell disease. Now, what is absolutely baffling to me, and not very many things baffles me in medicine, is the fact that people with sickle cell trait, not sickle cell disease, sickle cell trait, seem to have a higher propensity of bleeding from the kidney than people who have the full-blown disease. There are many peculiarities associated with sickle cell disease. For instance, people who have sickle cell C disease has more problem with their eyes than people who have SS disease, and so on and so forth. Those are non-clinical facts. No particular explanation. If there are explanations, I'm not aware of it and I don't know it, okay? So these are the things that you have to worry about. Okay, so find the person has sickle cell disease. You're taking care of them. You know that eventually the kidney is going to become affected. What do? Well, you do a lot of things. First of all, the first thing you do clinically, other than monitoring the kidney function test, etc., is lifestyle management. low salt diet, low simple carbohydrate diet to keep the weight down, low fat diet to keep the cholesterol and the other lipids down. Because all these things can cause other problems that can make the situation worse. You do that for everyone, but in particular for sicklers, for instance, it's perfectly okay for someone to walk around with a blood pressure of 130/80. That's a normal blood pressure, except that it's not a normal blood pressure in someone with sickle cell disease. It is a high blood pressure. Believe it or not, it is, if it's 130/80 and somebody with sickle cell disease, the pressure is too high. So it is the job of the doctor together. No doctor alone can treat blood pressure. It's got to be a combination of the doctor and the patient working together with a lifestyle management so that the pressure can be properly controlled. The doctor's job is to detect the blood pressure, evaluate the reason for it, and provide the appropriate, underline the word appropriate, because not all blood pressure medications are appropriate for everybody across the board. Absolutely not. That continues to be an issue of major contention in this country in particular and across the world, because people cannot avoid injecting the racial views into this very important disease, namely the black folks should be treated one way, white folks should be treated another way, Asians should be treated one way, and the Latinos should be treated another way, which is total nonsense, because the essential hypertension only has one reason, and one reason only. The fact that you inherited a gene called G protein receptor kinase type 4, which is originated in Africa, because in Africa the ambient situation was such that God came with the idea, in order for folks to survive the situation they were in, the heat, etc., not to collapse from dehydration when they're working in the farm like I did. I worked on the farm for almost 10 years, 8 in the morning to 5, and the temperature was almost 100 degrees constantly in Haiti during that time. And I survived because of that gene. If I didn't have that gene, I would have become dehydrated so vigorously, and all hypotensive, all kind of crazy other stuff would have happened. So what is wrong with somebody admitting that you're a human being? Because if you don't have G protein receptor kinase type 4 in your kidney, you're not a human being. I don't care the color of your skin. That's the reality. Granted, in 1992, when I wrote my first book, I hypothesized that, because that's the kind of brain I have. And sure enough, 18 years later, the gene was discovered. So big deal. You're a human being, you have a heart, you have a brain, you have a kidney, so you have that into you. However, you must take that into consideration when you're treating the patient for blood pressure, because what that gene does, it causes salt retention, period. Okay? Because it causes salt retention, how, you tell me, you are going to treat somebody with blood pressure if you're not giving them a medication that can remove the salt? Because wherever salt goes, water is followed. You're not giving a medication that can remove the salt by urinating it out in order to bring the pressure down. If you don't do that, the salt remains in the body, the fluid remains in the body. Eventually you wind up with congestive heart failure, because the heart kept over pumping to try to accommodate the height of this pressure. Eventually the heart becomes enlarged. The brain is under tremendous stress. The vessels are getting ready to rupture because of the tension the pressure is causing. Is that necessary to allow that many strokes to occur, to allow that many 5 million folks plus with congestive heart failure every year, 5.5 million? Is that really necessary? Is it necessary to let that many people kidney to fail because of some ridiculous concept of some crazy folks who think one person is better than another, which is hogwash? Is that really necessary? The answer is not necessary. Therefore, it is the job of the physician to understand the concept behind essential hypertension. So, who suffer most from sickle cell disease? Black folks. Latino folks. Remember, the percentage of sickle cell trait in this country is 8% as it is in Latino folks. 8%, no difference. Okay? And you have countries that have a tremendous amount of folks that don't want to accept or have difficulty psychologically or whatever accepting who they really are. And I respect everybody. I'm not saying anything negative about anyone, but it must be very difficult for somebody to survive wanting to be what you're not, when in fact everybody else can see who you are. It must be a crazy concept. Everybody can look at me and say, I'm a black guy. What's the big deal? I'm proud to be black. What is the big deal? You know? But you have no idea the stress that folks are putting themselves through, the parents for that matter, putting the children through, to force them into certain category. You belong here, you belong there, you shouldn't associate with this one, can't associate with that one. My God, this is the world that's falling apart partly because of this craziness. The number one psychological problem in the world is racial discrimination. That's the number one psychiatric disorder. The people who run the psychiatry writing all these crazy books about this and that, they don't want to face this stuff because they're dealing with that confusion themselves. The truth is, it's a number one psychological disease, psychiatric disorder, period. So when someone has sickle cell disease, they're either black, Latinos, or other racial groups who have it, and there's so many. In fact, there are more people that are not identified as black who have sickle cell disease than people who are identified as black. I mean, I'm sure you know what I'm talking about. So these people also are likely to have high blood pressure. What is the number one disease in black folks? It's not sickle cell disease, it's hypertension. 1 out of every 3 black adults have hypertension. So therefore, you're going to combine elevated blood pressure, which damages the kidney seriously, in conjunction with sickle cell disease. That is the reason why when the blood pressure is 130/80 in someone who doesn't have sickle cell disease, that's perfectly fine. But if they have sickle cell disease, it's too high. The kidney is already feeling the effect of it. So that's a double whammy for the kidney. The kidney is also already struggling to have this cell passing through it, creating all sorts of devastation. And now you have the blood pressure becomes elevated via a completely different mechanism. Is going to affect the kidney as well. And the person has diabetes mellitus. The incidence of diabetes mellitus is quite high in the minority community as well. So therefore, you have this combination. And I have such people in my practice. I managed to keep them going very well, thank you very much, because I'm paying attention to all these different other problems that they have. I don't take care of one problem without the other. I have people in the mid-70s in my practice who have sickle cell disease that haven't been admitted to the hospital in the last 15 years. I haven't even transfused them in the last 15 years with blood, which is the number one treatment for sickle cell disease, because of the way I am cutting here a little bit there, a little bit there. Every time, let's move this, let's do this. Every time I see them, we change things around, and they're coping, doing fine. Okay? So that is why you have to be so careful when somebody has sickle cell disease. How do you evaluate the kidney? Well, first thing you do, of course, is to always examine your patient and do a complete exam. And of course, you will do a urine analysis. Crucial. Urine analysis is very important because if the person's blood sugar is very high, there'll be sugar in the urine. If the person's kidney is very damaged, there'll be protein in the urine. There could be white blood cell in the urine indicating a problem. There could be bacteria if it's a clean catch urine indicating an infection, etc. There could be crystals seen in the urine consistent with some crystal formation disease, etc. So on and so forth. So the urine is very important. Also the specific gravity of the urine. We know what is the specific gravity. Specific gravity tells you how dense the urine as a fluid is and is not. Very, very important. Because, for instance, let me give you a for instance. I'm giving a lot of for instance in this segment. people with sickle cell disease, you didn't even know. If they have sickle cell trait, they have a condition that prevents them from concentrating their urine. You're just learning that for the first time. That's right. Let me repeat. People with sickle cell trait has an abnormality that prevents them from concentrating their urine. If you didn't know that as a medical fact, you just learn it. They cannot concentrate their urine properly because of the sickling phenomena to the kidney. Why sickle cell trait and not sickle cell disease? Don't ask me, because I don't know. But I'm telling you that. Put that in your pocket. Don't for 1 second think that sickle cell trait does not cause problem. Before I finish this series, I'll take time to talk about sickle cell trait by itself separately. You will be amazed to find out the different things that are abnormal that someone who has sickle cell trait can be suffering with. Okay? So now, the next thing you will do, of course, you want to do the blood count. Why the blood count? Well, because the level of red blood cell is crucial in somebody who has sickle cell disease because of the hemolytic process that's going on all the time. But when they have kidney disease associated with that, it's worse. Why is it worse? Well, there's a protein called erythropoietin. Erythropoietin. It's produced by the kidney. Erythropoietin, since birth, since we were in our mother's womb, all human beings start producing erythropoietin. So that's where it is produced in the body. So the sicker the kidney, the lower the level of erythropoietin. The lower the level of erythropoietin, the lower the level of the red blood cell. So this is the double whammy. Again, the sickle cell causes the kidney to become sick. Now the kidney is sick. The patient is already anemic to begin with. Now he or she is more anemic because now the kidney cannot function properly to produce red blood cell because there is no sufficient amount of erythropoietin. The erythropoietin is produced in the kidney, and then from the kidney it is released into the bloodstream, taken to the bone marrow, where it stimulates the production of red blood cell. That's how we make red blood cell. So that's a big issue. Okay, what is the next thing you want to look at? Well, I just mentioned to you the white blood cell, the red blood cell, the urine. Now you want to look at what's called the kidney function test, which are the blood urea nitrogen, creatinine level, and the electrolytes. Crucial. The potassium is very important. Chloride, sodium, CO2, very important. It's crucial because the kidney is where these things are created pretty much, and the sicker the kidney, the more abnormal these tests become. That is why we know when it is time to dialyze someone. That's correct. It's not only the way they present clinically, even way before they develop what we call uremia, and it's a different, uremia is a chronic disease that is a different syndrome from just plain regular kidney failure, because not everybody with kidney failure is uremic, okay? That's a different stage of it. But way before they get there, we know exactly how sick the kidney is getting. We could do the glomerular filtration rate. We could do that. We can get that by the blood test from the laboratory. And or we could send 24-hour urine collection to the laboratory for the urine creatinine clearance, as well as the 24-hour urine protein. We know how much protein the patient is passing. That is very crucial. And I can make it even more interesting for you. Namely, the amount of protein the person is passing in the urine not only determines how sick the kidney is, it also determines how sick the person is. You say, well, how so? Well, there's a condition called nephrotic syndrome. The total number of grams of protein passed into the urine determines if the person is nephrotic or not. That's what is the big deal. It is a huge deal. It's a big part of kidney disease. And to make matter even worse, you can clot. Now, sickle cell disease itself increases the risk of clotting, causing stroke, etc. Now, I'm just telling you to make matter more complicated and interesting for you that passing tons of urine, as it were, I mean, not tons, a lot of protein is a better term, into the urine can cause you to clot. They say, well, what are you talking about? But what I'm talking about is that when you're passing a lot of albumin into the urine, you're also unfortunately passing a lot of protein S and protein C, because you can't discern which is which. You could test in the blood to make sure they're low, and they will be low. So frequently, these people will clot. And what is worse is that they clot the vessel that carries blood from the abdomen to the kidney. They clot that. And the person will present with severe abdominal pain if you don't know enough clinical medicine to suspect that. How do you go from protein loss into the urine from a clotting disease? I just told you how. Because when you're losing, when the kidney is so damaged, the part of the kidney that holds the protein is so damaged that protein is coming out just like water out of the faucet. Every time you urinate, tons of protein coming out. That causes a tremendous amount of problem. And unfortunately, frequently, part of that protein contains protein S and protein C. Once you lose either one of them or both of them, you become hypercoagulable, which means you could clot anywhere in the brain, the heart, in the legs and the lungs, or for that matter, in the vessel that carries blood inside the abdomen. You could clot that. This is stuff, you have got to know this stuff. If you don't know this stuff, please learn it, because it is a human being that entrusting themselves into your hand for medical care. You have got to know it. If you don't know it, please go back and refresh. You may have learned it or still learning it. It is crucial that you keep this stuff every day in front of your head as you practice medicine for these people, because kidney disease is so common and sickle cell disease is also so common. Listen, I'm going to stop now. Next week I'll continue again to talk about sickle cell disease. Until such time, keep watching the show. See Dr. Alcena saying so long and bye-bye.